But I think my own feeling is it's not bold enough. It would have been really good. It's a good start, but it needs to be a lot bolder. On the funding side, it's very good because it feels that social care should be free, but of course it doesn't address the whole issue of residential care. And of course, it's all very well having human rights as the framing, but what we've known throughout this pandemic is that human rights have really been thrown out of the window for relatives, residents, carers in the pandemic. So the right to family life, the right to visitors, the right to see your family has really been undermined in a major way. And so, of course, in the early stages was the right to good healthcare. And we know that because of the high number of deaths that took place in nursing homes and the fact that many people in nursing homes died and didn't get the access to the hospital care and the care that they needed.
We have this illusion in Scotland that somehow in Scotland we've managed the pandemic better than anywhere else. It is rubbish, utter rubbish. We have almost to the letter followed what the UK government has done, and that has been utterly disastrous. We've got some of the worst death rates in the world. And if we look at that human rights catastrophe of older people, denied hospital treatment when they should have been hospitalised, having DNR notices, do not resuscitate notices, put upon them without their knowledge or their family's knowledge, staff denied PPE, residents denied testing, and that madness of discharging people untested into the care home sector to allow the virus to run rife. And we have somehow managed the pandemic better than anywhere else. Well, if that's better, then I want no part of it.
I think the thing that strikes me and is worth remembering is that the Findlay report, Derek Findlay's review, was commissioned by the Scottish Government in September to review adult social care provision in Scotland after 2,000 people died in our residential care homes, which in Scotland was half the total at that stage, one of the biggest proportions in the entire world. So that's why Findlay was commissioned, and therefore we have to see his recommendations in that very, very serious light. Because the widespread public view, as Neil and Alison and Trish have already pointed out, is that residential care provision in Scotland is not fit for purpose. And it hasn't been fit for purpose for decades now. The present model is expensive, is provided, as Neil rightly points out, and nobody should forget, largely by private companies for profit. And it's a model that, frankly, the government are powerless to control. And on top of that, the quality is often poor. So Derek Findlay recommends, and if you've not got time to read the 109 pages, just cut to the last 9. Because the last 9 really cuts to the chase. And Derek Findlay recommends the establishment of a national care service, but virtually in name only. The establishment of a national care service, where he recommends that there's a care minister to sit in the cabinet next to the health minister. He recommends the appointment of a highly paid chief executive for that care service on the same salary as the chief executive of the NHS, which he used to be. He recommends the appointment of 6 chief operating officers, also on handsome salaries. And that's it. That's it. Nothing about it should be free at the point of need. Nothing about it should be publicly owned and run. Nothing about this is a service that, instead of being a national scandal and an embarrassment to the people of Scotland, should in fact be a world leader and something that we are the envy of the world about. It's nothing to say about the fundamental feelings of the population of Scotland. And at the centre of this debate, and other speakers have rightly touched on it, there's an ideological choice here between public service or private profit.